I think if young people truly understood how low their risk is, and unfortunately, public health authorities have done so much fear mongering to try to get young people to be compliant with lockdown, and they have exaggerated the risk to young people. If they understood how low their risks really were, like for people under age 60, the risks are lower than they are from influenza. So we need to just very low risk of dying of this disease, that they would make the decision to just get on with their life.
Okay, yeah, that's not too bad. I have my orange juice, I have my vitamin C. Welcome everyone to, I guess, this has just been an extraordinary series. I mean, I just looked at a video that Grant put together that's kind of gone through a lot of the people that we've interviewed, and it's shows me just how much work has been done. And the thing about it, I think we've just started. And today, I'm very happy because I think the guest we have today is coming at a time that is necessary. It's very timely. No coincidence, of course. So he is a retired physician, Ontario's Chief Medical Office of Health for almost 10 years, from 1987, I believe, to 1997. And Dr. Richard, I hope I'm saying his name correctly, Schabas, and I'm sure he will correct me if I did not say it right. He's been paying very close attention to what's been happening since this pandemic started, and a lot of the stuff coming out, of course, from the World Health Organization. So one thing I do want to note about Dr. Schabas is the fact that he was a chief of staff at York Central Hospital during the SARS crisis in 2003. And he's been doing this for over 40 years. Again, he's just most recently retired. And today, so happy that he took the time to come and speak with us. Today, we're going to be looking a little closer at the pandemic, and of course, the fact that as of today, new lockdowns are being put in place again. So I would like to welcome to Toronto Caribbean Newspaper and the MyTCN TV audience, Dr. Richard Schabas. How are you?
I'm good, thanks.
Did I say your name correctly?
Yes, you did. You nailed it.
Yes, it's good. I'm off to a good start. So I've been combing through your work since we last spoke, which was yesterday, and there's a lot that you've said, and I'm going to be saying a few things that I've seen that I want you to kind of expand on. And I know you've been talking about this, so I hope you don't feel like a broken record. Let's talk about, first of all, why you call this a shrinking pandemic.
Well, I wrote that in an opinion piece I wrote at the beginning of March, when in fact the numbers were coming down. And that was a short-lived phenomenon, and I was wrong in the sense that I think I believed at the time that it would continue to shrink, and it hasn't, obviously. Obviously, that was wrong.
Right.
I also at the same time said, but listen, we can't be complacent. We have to keep our eyes and ears open, and if I am wrong, and if it does start to spread, then we have to be more vigilant and be on top of it. So those are the circumstances. It's not a shrinking pandemic. On the other hand, it's not quite the global catastrophe that it's been brought up to be.
Right.
Since it began at the beginning of this year, approximately 45 million people have died in this world, and about 1 million have died from COVID. So that's very tragic, and it's what happens with respiratory viruses. We expect about 2.5 million people to die every year from some form of pneumonia, many of which are caused by viruses. So what's happened is a very tragic event. It's comparable to an influenza pandemic like we had 11 years ago. It's a tragic event, but it's not a catastrophe, and it's something that we need to find a practical way of getting through, which I think is where we've really struggled.
Right. And you mentioned a few things when talking about this, just as it's been happening. You said, and I've seen this come up in some of your other interviews, quarantine belongs in the Middle Ages. You kind of talk about, well, let's talk about Why? What are your views on this lockdown since then and the one that we're going into right now?
Okay, so the lockdown that we appear to be going into in Ontario is unnecessary, it's destructive, and it ultimately leads us nowhere. And the reason I say that, first of all, it's unnecessary because the important thing about COVID is not the disease itself, it's the serious complications of the disease, the deaths in particular, and the serious illnesses. And there's been quite a remarkable change in the last 3 or 4 months in the profile of COVID, in that the death rates have come way down. And whereas in Western Europe, for example, as well as in Canada, in the outbreak in March, April, the infection fatality rate was probably in the range of about 1% or pretty close to 1%. It's now dropped by almost an order of magnitude, primarily because it's no longer the frail elderly who are getting infected. It's young people. And young people, thank goodness, hardly ever die from this. And so the magnitude, the number we should be looking at in Ontario is not the case count, it's the death count. And the death count
Okay.
lags behind the case count by a couple of weeks, but it's very low. I think there were about 4 deaths in a province of 14.5 million people, a province where, by the way, 300 people die every day. So I think it's an overreaction to a threat that has been overstated, has been exaggerated. Number one.
Okay.
Number two, it's very damaging. I think I almost don't need to explain why it's been so damaging.
Right.
Damaging to people's lives, damaging to education, damaging to healthcare, damaging to the economy, and in a very unfair way, because the burden of the lockdown falls disproportionately on the young and on the poor. And it's the well-to-do who have comfortable homes and can work from home and don't feel the financial pressure, who are the ones who are making the decisions here, but it's not falling on them. So it's destructive in an unfair way. And it leads nowhere. I mean, they say the definition of insanity is you keep doing the same thing and expect a different result. Well, we locked down for 4 months, and we got some warm weather and we opened up. And guess what? In September, as was widely predicted by me and many other people, it came roaring back. The lockdown that we suffered through in the spring really accomplished nothing. I think when we locked down in beginning of March, middle of March, people thought it was going to be for a couple of weeks till we got our healthcare system in order. Well, we did. There was no strain on our healthcare system. In fact, there's been no overrunning of healthcare systems anywhere in the world, with the possible exception of Northern Italy. So that was a bit of a red herring, but regardless, the lockdown didn't last a couple of weeks. It lasted more than 3 months. And the only thing really that got us out of that lockdown was the summer weather, because it's a respiratory virus and it doesn't spread as well in warm weather. Well, now the fall comes around, and what we're seeing in Canada and in Western Europe and in parts of the United States is that it comes back as the weather gets cooler. Well, that's great. If we lock down now, when do we come out of lockdown? Do we wait till next summer when we have no society left? Doesn't make any
Right.
sense. We have to realize that all lockdown does is to change the dates. It doesn't fundamentally change anything about this outbreak. It's a strategy that leads nowhere.
So you said something, because you said there was really no strain on the healthcare system, but I know, seeing many things about how the hospitals were full and there wasn't enough beds, and there's a lot of like hype during that time. So you're saying that none of that was like true?
Well, not back in the spring in Ontario. No, our intensive care units were 80% empty. Eric Hoskins, the former Minister of Health, wrote an op-ed on this in Globe and Mail in the middle of April and pointed out how we never had more than about 200 or 250 people with COVID in our intensive care units at any one time in Ontario, and I believe we had 1,400 beds or somewhere in that, or some, anyway, a very small proportion. Our ICUs were almost entirely empty. No, the problem in Italy was very complicated. But basically the Italians made some serious mistakes on how they used healthcare. They admitted everybody with COVID. They were lax about infection control, and they had a real problem. But since then, places have coped. Even New York City, which had the largest, most intensive outbreak
Right.
probably anywhere in the world. In fact, some hospitals were overwhelmed, but many others were largely empty because New York, unlike Ontario, they don't have a healthcare system. They just have
Mm,
individual hospitals. So it's a
right.
private hospital, they're empty. It's a public hospital, it's full. But that's not going to be a problem here. We have a much more robust, better organized healthcare system. So we
Hmm.
can cope with this. We can cope with anything that this disease can reasonably throw at us in terms of healthcare. We're ready. So that was, I think, why many people thought we shut down in the spring. It wasn't a real issue. It's not a non-issue now. It's something we have to be careful with it, but
Yes.
it's not something that's going to overwhelm us.
Okay. Let's talk. You mentioned something about non negotiables, which you've kind of mentioned as we've been talking. Things like education should be a non negotiable. So, with that, I guess you didn't really agree with them locking down the schools during this?
No, I'm a public health doctor. I spent my whole career as a public health doctor, and probably the most fundamental belief, at least until 6 months ago, of public health doctors in Canada is that what's really important to our health is what we call the social determinants of health. It's not everybody thinks it's health care. It's not. It's not. What really makes us healthy, makes us the healthiest people in the history of the human species, is that we have things like education, we have things like employment, we have things like robust social interactions. That those are the things which really are most fundamental to keeping us healthy. Those are, from a public health standpoint, those should be the non-negotiables. So to close schools and damage the education of a whole generation of children, you may get some short-term buzz in terms of reducing your transmission of COVID, but you are going to be paying the price for that in
Yes.
health terms, in terms of
Yes.
increased mortality, increased disability,
Yes.
increased mental health problems. You're going to be paying the price for that for many decades to come.
Oh,
One of the real
wow.
problems here is that we become focused on one disease. We become focused on COVID
Right.
to the extent of all other elements of health. Yeah, COVID is a real problem, and it's killing far more people than I ever thought it would. And it's something, particularly for the frail elderly and long-term care, is a really serious threat. But, you know, 300 people die in Ontario every day of other causes. Since COVID got started, for every person outside of long-term care who's died of COVID, more than 50 have died of something else. So let's
Right.
keep some perspective. Let's not throw the baby out with the bathwater here.
Absolutely. There was one other thing that I really wanted to talk to you about. Well, a couple of things. Masks. Save your masks
Yep.
for robbing banks.
Yep.
Let's talk about this.
Yeah. I mean, well, the whole phenomenon with masks has been absolutely remarkable. The sentiment that I expressed, that was something I wrote at the beginning of March. And I would say that probably 99% of public health and infection control experts, certainly in the Western world, agreed with me at the time. I was simply expressing a mainstream idea that masks were not going to be useful. And that's an ideology that's based on a fairly substantial body of evidence, looking primarily at influenza, in which the benefits of medical masks in some circumstances, like in healthcare and in dealing with household contexts, there are some benefits. But beyond that, the sort of public general use of masks, particularly of non-medical masks, was something that was there was really no evidence to support, and was generally, I think, dismissed by me and by most other public health experts. And then this remarkable thing happened in April and May. Suddenly, the world turned 180 degrees. Now, that would be understandable if there was some major new robust piece of scientific
Right.
information that came forward. But there was not. There was not. There were a few very low quality studies related to masks and COVID. There's what we call this ecological correlation, where people said, well, look at countries in East Asia where everybody wears masks and they don't have a lot of disease, which is true. But of course, there are also all kinds of countries, for example, in Africa, where people don't wear masks and they have even less disease. So
That's right.
was it the masks? I don't know. That's very, very weak evidence. And
Mm.
anybody who's trained in epidemiology knows that's very weak evidence. And yet, suddenly, everybody flipped 180 degrees, and masks became not just something that was useful, but sort of the fundamental building block for
Yes.
controlling COVID. Well, okay, so we've got mandatory masks in Ontario, and when you go out into public places, you'll see about 99% of people wearing them. And what's going on? Disease rates are shooting through the roof. It's working really well, isn't it?
So, I honestly, what's disturbing, I think, mostly is the fact that every single, I guess, expert, I'm going to say, in their field who's spoken about this has said the exact same thing you have. And I think maybe what my question is, what are people not like? I don't understand. Why are these people still wearing these masks? If this is obvious, like these things are very obvious. Why do you think people are still so caught up on this?
Well, I mean, in fairness to masks, I think there is at least some weak evidence in support of masks, and
Okay.
I don't get too excited about someone who wants to wear a mask in an enclosed public space. If they want to do it, that's fine. If you don't want to do it, that's fine too. I don't agree with mandatory masks because I don't think the evidence is sufficient. But that's the way it is. But something else has happened. Masks have become kind of almost a symbol. It's almost like a biker gang wearing your colors. You know, I'm showing that I'm on the side of the good guys because I walk around the streets. It's people who walk outdoors proudly with their masks. I mean, outdoor masks, in terms of disease
Oh God.
control, that's just silly. It just makes no sense. There's no evidence to support that. There's no rationale to support that, and yet people do. Why do they do it? I think it's because they feel good about it. It identifies them as being on one side of this. They feel they're doing
Mm,
something, but it's a false sense, I think. So and tragically, look, it would be great if masks worked. I would be delighted to be wrong about all of this. I said when I spoke to the House of Commons in May, I said I don't think contact tracing and testing is going to control this disease. I said I
okay.
hope I'm wrong, but I don't think it will, and obviously it
It
hasn't.
it
I'd
didn't.
love
Mm-hmm.
masks to control this disease. I don't like masks, but I'd much rather deal with wearing masks than face these lockdowns. Much rather. But the problem is, from what we can see, not just in Canada, but in Western Europe, where most countries are deeply into masks, is that it clearly is not making any kind of substantial difference at all. So we have to get our mind around the fact that this is a respiratory virus, and because we don't have a vaccine, we don't have the tools to control the
Mm,
spread of infection appropriately. We just don't, and that's just the way it is. It's a little bit like King Canute standing in the way of the tide. You'd love to stop it, you can't. The only way we can try to stop it is to do a lockdown, and that's like cutting your arm off because you
mm.
got a hangnail. It doesn't make any sense. So we can't do that again, I hope. So the problem is we have to get our mind around the fact that we are not all powerful. We don't
Yes.
have all the answers, and this is a respiratory virus that we cannot stop. We cannot really effectively control. What we can do, though, is we can mitigate it. We can get past all this. We can protect the vulnerable. In fact, I think we're already probably doing a far better job of protecting the vulnerable than we did in the spring. That's
That's
why
good.
our infection fatality rates are down so much. It's because the young people are getting it and the old people aren't. So we've already, in a sense, got it half right. We've already made huge strides in protecting the elderly. And now we have to just say for the young, for people, and young, I mean, essentially anybody under 60 without a serious comorbidity is at extremely low risk of serious consequences from this disease. They should just suck it up and get on with our lives. And in a couple of months, we will be largely done.
You know what? I only have one more question. I think you've answered pretty much everything. I always want to have a solution. What would you advise for people right now, even though it looks like we're going to be going back into a lockdown? What would you advise people just to be taking better care of themselves, sorry. What would you say to one of your
Yeah,
patients?
yeah. I mean, so here's what I think. I think that we need to make our own decisions about how much risk we're prepared to face and how we're going to trade that off. I went through this personally back in March. I'm 68 years old. I don't have comorbidities. I'm kind of right smack dab in the middle of COVID risk. I'm not high risk. I'm not low risk.
Right.
I worked through the numbers, and at age 70, you've got about a 1% chance of dying every year. That's just the way it is. I'm not keen on it, but that's the way it is.
Right.
And lower for someone who doesn't have any comorbidities. But, I estimated my risk of actually catching COVID if I was somewhat careful, and of actually dying of it if I got COVID is probably in the neighborhood of about 1 in 10,000. So it's not a zero risk. Same risk as I'd face if I drove 10,000 miles. So it's not a zero risk. But I said to myself, am I going to turn my life upside down? Am I going to hide in my home because of what I perceive as being a relatively small risk to my life and well-being? And I thought, no, I'm not going to do that. I realize if I go out and walk the streets and I go to the supermarket and I see my grandchildren, that I'm exposing myself to what I think is a very small risk of contracting this virus and of dying of this virus in particular. But I'm not going to give up 6 months or a year or 2 years of my life because of that. I'm going to do the calculation, and that's what I'm going to do. And I think people need to be better informed to allow them to do it. I think if young people truly understood how low their risk is, and unfortunately, public health authorities have done so much fear mongering to try to get young people to be compliant with lockdown, and they have exaggerated the risk to young people. If they understood how low their risks really were, like for people under age 60, the risks are lower than they are from influenza. So we need to just very low risk of dying of this disease, that they would make the decision to just get on with their lives. And for older people like me, and people like my parents who are locked in a retirement home without being allowed visitors, terrible situation.
Yeah.
They should make their own decisions too. And many of them will say, you know what? I'm getting on. I don't have that much life left. Yes, if I carry on with my life, I might catch COVID and I might die. But on the other hand, I'm prepared to take that risk because I don't want to lock myself down for 3 months, 6 months, a year. That's a reasonable decision. I think people should be making their own decisions about their own level of risk and acting accordingly. And if you've got a young person who's terrified of this and wants to live in a cave for the next 5 years, it's a free society. They should be allowed to do that. Although
Right.
I think that would be pretty tough.
You know what? I love it. It was a great way to, and you're right. I think that's why I really had you come on today. And I really appreciate you coming on, because I think people need to just be doing more research. I don't think we're doing enough. I think we're just listening to what's being fed to us and just kind of following it instead of actually saying, okay, like, where do I sit in all of this? So thank you for bringing that up. I appreciate you. I really do. You did this last minute, and it was great. We really appreciate you doing this for us.
My pleasure.
Be safe. Take care of yourself. Have fun with your grandchildren. Enjoy Thanksgiving.
I will.
Have a good Friday.